getting to the section where I'm going to be talking about pain and how to cope with pain and what your options are. But first of all, I want to talk about mindset and how your mindset can affect your birth experience. It can affect how quickly or how slowly your birth goes as well. And it's all to do with fear, and it's all to do with the fight or flight mechanism as well, which I will go on to explain in depth. I want to start by telling you a little story about a woman who I looked after once in labour. So this lady, she came into triage. She had been having contractions at home most of the day, and over the last few hours they had really picked up and they were coming every 3 minutes. She'd gone through the night and she'd been having these regular contractions, but they were only about 10 minutes apart. By the time she got to the morning, she was still having them 10 minutes apart. So her husband went to work because she didn't think they were strong enough for it to warrant, full established labour. Within a few hours of him going to work, things really kicked off and she started contracting every few minutes. So she came to the hospital with her sister. But she was so uptight and so worried and so concerned about the fact that her husband, who was working over an hour away, wouldn't get to the hospital in time. She was so concerned about this that actually her contractions stopped. Now I thought maybe she wasn't in full established labour, so that's why she was just in prodromal labour and things hadn't really started properly. But by the time he got to the hospital, within about 10 minutes of him arriving, her contractions started again. And I truly believe that the mind is capable of halting or affecting labour in some women. So the mind has the ability to affect our labour and birth experience. There is a sympathetic and a parasympathetic nervous system. Now, the sympathetic nervous system is what kicks in when we are fearful, when we are anxious, when we are in a state where we just want to get out. And what happens is your heart rate increases, your body releases adrenaline, and basically everything else shuts down, because what your body is trying to do is trying to get blood to the brain, to the heart, and nothing else matters. So oxygen won't go to your uterus, it won't go to contract properly, and you are basically in a sense of anxiety or fear. When the parasympathetic nervous system kicks in, that is when we start releasing all the love hormones, so oxytocin and melatonin and all the nice hormones, the endorphins, that help us to feel a sense of calm and relax. So our breathing relaxes, our heart rate slows down, our oxygen is able to flow around our body freely and is able to go to our uterus, which needs it to contract, which is why it's so important that we are in an environment where we're happy to give birth. We're around people that we are happy to give birth around and to be labouring around. Because when women are in a sense of fear, anxiety, or feeling uncomfortable, and that sympathetic nervous system kicks in, that can have a big impact on how your birth goes. When we are going through pregnancy and we have negative thoughts, that can also impact our birth. If we have negative thoughts which doubt our ability to give birth to our babies, or we've heard stories from other people and we think that's going to affect us as well because their birth experience has been terrible, so your birth experience is going to be terrible, then the sympathetic nervous system is really going to kick in and it's going to have a big impact on the big day. So it's really important that your mindset changes before birth, that you share your experiences with the right people, make sure you have a birth partner that is supportive, make sure your care provider knows exactly what your wishes are and your wants are throughout labour. Don't feel afraid to ask questions. Don't feel afraid to seek a second opinion if you want to, if you feel that you need to. And remember, this is your body and this is your baby and this is your birth as well. This is your experience. But what we want to do is have relaxation, have techniques that can get us into that deep mindset where that parasympathetic nervous system can come out to play. So one of the things that you can do to get that parasympathetic nervous system to come out and play is to practice your breathing. Now, when you're having a contraction, the last thing you want to do is start breathing rapidly, okay? You need to breathe deeply and slowly. So when you start feeling a contraction building up, you need to do what we call up breathing. which is where you breathe in deeply through your nose if you can, if your nose isn't blocked, which is a lot of women are through pregnancy, but if it's not blocked, breathe deeply in through your nose, count slowly to about 6. So and then you breathe out and count to about 6 again when you breathe out. So that's breathe in through your nose, count to about 6, and breathe out, count to 6. And you keep doing that until the contraction goes. And each time you have a contraction, remember the theory, you can do anything for 10 seconds. Even though contractions last for a little bit longer than that, give yourself 10 seconds and be thinking to yourself whilst you're breathing, in through your nose, out through your mouth. Think to yourself, I can do anything for 10 seconds. I can do anything for 10 seconds. I can do anything for 10 seconds. And as you're doing that, before you know it, the contraction will be gone. The idea is to keep focus and keep calm through each contraction. And remember, they will get more and more intense, but you will get to a point where the intensity will slow down a little bit, which is when you come up to, or when you're in transition. Keeping mobile during labour is also a good way to help cope with the contractions as well. Many women can get into different positions. It depends on the person. Some people like to be sitting up, some people like to be lying on their side, some people will prefer to be on all fours or kneeling over the back of the bed. It all depends on the woman. But ideally, being in an upright position is the most optimal position to be in. If you look at mammals in the wild, you won't see any of them lying on their backs to give birth, because that is not what nature intended. You wouldn't lie down and go to the toilet to do a number 2 on your back. You would be sitting upright, you'd be squatting, over the toilet. And so it's a similar thing with labour, really. And you'll find that usually, for most women, that being upright and being able to move your body around will help with the pain of the contractions.